Dr. Goodyear, welcome to the show. Everyone seems to know someone that's had a battle with cancer. My father passed away from cancer.
For me, it became very apparent that we're not winning this war on cancer. We're going to move away from surgery. We're going to move away from chemotherapy. We're going to move away from radiation, and we're going to go right to the tumor. That's actually what we're doing at the Williams Cancer Institute, Lee. So we need to get ourselves active, not just in cardio, which most people focus on, but right up your alley, building muscle. But beyond that, the best answer to cancer is...
Doctors have asked you in the past, why give hope to a patient with cancer? I mean, you told them, because I'm a doctor.
Welcome to the Lee Labrada Show. Brought to you by Lean Body, the #1 protein shake in gyms across America.
Welcome back to the Lee Labrada Show. Glad that you guys could join us. Guys, the reason that the show exists is to help you to improve your physical, mental, and spiritual health. My show's growing fast and becoming very popular thanks to you. So if you're enjoying the content, would you please hit the like button below now and forward the show to at least one other person. And that's how we continue to grow, and that's how I can keep bringing you content that you can grow with. On this episode, we're going to be talking with one of the country's leading natural, holistic, and integrative experts in the cancer field. He is part of the team at Williams Cancer Institute, a holistic, integrative cancer healing center. Dr. Goodyear, welcome to the show. It's good to have you here.
Lee, it's an honor to be here with you. Great to wrap up a week on a Friday with you.
Thank you so much. And please, let's start by telling our viewers your story. What is it about your practice that makes it different? What is integrative therapy?
Yeah, so, I finished my training in 2004. And when I went out into the medical practice world, because I am an MD by original training, a conventional pelvic floor surgeon. But one of the things that I started to discover, as many do, is when you get out into private practice, the things that you're taught through your training don't necessarily line up for everybody, because we don't have a chance to follow everybody through. So I very quickly got into the integrative space, and that word integrative, it literally means to restore, remake, renew. So it really fits into a whole plethora of possibilities. But I got into that with hormones, of course, wellness, health, age reversal. But then as you start to get into hormones, there's always this topic that steps in called cancer. Well, how are these hormones going to impact my cancer risk? I had cancer, and so how are these hormones going to impact my recurrence? So always very real. And so from that standpoint, cancer became a growing, budding part of my practice. But then I had my own bout with my own tumor, what's called a pheochromocytoma, a very rare tumor that actually causes the release of massive catecholamines and blood pressure 300 over 130, wow, etc. So I knew at that point I immediately was called to be in the cancer space. Came out to Arizona, became a licensed MD homeopath, and then ran 2 clinics in the integrative oncology space out here in Arizona. But when you look at cancer is a constantly evolving, mutating group of cells. And so it became very apparent to me, though under my leadership I was doing great things with patients, I needed to work with others to innovate, because we were falling behind, because cancer was constantly evolving and mutating. And so I left my leadership role to join with a team, particularly a colleague of mine that I actually went to medical school with, Dr. Jason Williams. And so we worked together, a group of doctors, where we're innovating in the space of cancer, and we're innovating in the space of regeneration. Because they're really, in many ways, one and the same. So a little bit of a long journey around the horn, but that's how I've came to where I am today.
It's fascinating. And Dr. Goodyear, our viewers, a lot of them are interested in staying healthy, of course, and many of them exercise and eat right. And as we get older, one of the big concerns becomes, how do we stay healthy as long as we can? So everyone seems to know someone that's had a battle with cancer. I'm no different. My father passed away from cancer. And getting cancer is something that we're all afraid of. What makes some people get cancer and others not?
So to dive into that, let me ask you a question firstly. What do you think is the number one cause of mortality in developed countries, high-income countries? What's the number one cause of mortality?
I would have to say heart disease, cancer, and I think that a lot of it has its roots in inflammation. Am I close?
You're close. It was really interesting. Everybody looks at cardiovascular disease as the number one cause. And you're right about chronic inflammation, and we could talk for hours as it relates to that. But there was an article, research epidemiologic study came out called the Prospective Urban and Rural Epidemiology Study. It came out in 2019 in the Lancet journal, so very prestigious. And they found that in high-income countries, the number one cause of mortality was was cancer in adults. So you had to look not in children, but actually in adults. But what's interesting about that is that it didn't just barely surpass cardiovascular disease. It did so at a rate of 2.5 to 1. So cancer is this exploding disease. And so for me, it became very apparent that we're not winning this war on cancer. And so our approach to cancer must change. And that's the reason why I made the change. And it's that different focus that I think is going to help us to provide better solutions to cancer treatment. But you're exactly right. There's probably no word that garners more fear than that word cancer. And we're not helpless in that. What I always tell our patients is that the best answer to cancer is to never get it, prevention.
Of course.
But beyond that, the best answer to cancer is the immune system. But here's what may surprise you and your listeners. What connects those two is the immune system. It's the immune system.
I'm going to be
in cancer.
I'm going to be asking you about that, about the immune system. We had a very interesting conversation, guys. Dr. Nathan Goodyear and I had a very interesting conversation about a couple weeks ago, and that was one of the things. We're going to be talking about that. But before we get to that, can I ask you, is there a protocol that you recommend for reducing the risk for cancer? What are some of the things that our viewers can do that are within their control?
Yeah, I think the great thing about cancer prevention is the best way to prevent cancer is a multitude of things that we all can do. And a lot of them, they're actually very simple. And then I'll touch on why, though many people do these things, we are still seeing cancer grow in number, and that's why we need to make a change, is clearly eating real food. And you know what amazes me, Lee, is that most people, I think your listeners may completely understand this. Plant-based food, grown organically, limited to no pesticide, with red meat, it's well-grown meat, no hormones, et cetera, et cetera. But most people, the average person in the United States even, and then across the world even worse, they don't understand what real food is. They think it's a Twicker bar and a wrapper and a Coke. We're talking about food that actually feeds nutrition. I tell patients that, look, if you feed yourself junk, don't be surprised if your genetic code gives you junk back. So good nutrition, but we have to define that for people because sadly, that is missed on most people. The second is activity. If you look back to our hunter and gathering days, or even the last 100 years, we've become a very non-active culture. We sit, we watch, we're not out working, and thus exercise becomes a role where we try to keep ourselves active. So we need to get ourselves active, not just in exercise, not in cardio, which most people focus on, but right up your alley, building muscle. And that really needs to start at a younger age, because once you kind of get into those 50s and 60s, that what I call that kind of muscle memory, it's kind of lost on us. Good sleep, good relationship in conjunction with that limitation in activity. What I've noticed is we're not continuing to develop relationships. We're getting more and more isolated. And then from that, also controlling stress response. So those are 5. But even in spite of those things, working on those, one of the reasons why we're seeing a continued surge in cancer is because of epigenetics, changing in genetic expression, our gut microbiome. And these are things that are countering these great tools that we all have right there with us. But it's growing at an exponential rate, and it's surpassing these key skill sets. And so that requires us to need to change our approach to allow those 5 tools to go back to benefiting us again.
That's really fascinating. Now, you did mention exercise and activity, and I could not agree with you more. So one question that came to my mind more specifically is this: does the amount of muscle tissue that you carry decrease the risk of getting cancer?
That's a good question. There's, I can tell you on one side, I can't tell you about the other side, but on the low side, that means low muscle mass, okay, high fat content. Absolutely, that increases cancer risk, a wide variety of cancer types. And in fact, you can connect that, Lee, right back to the gut microbiome, leading to leaky gut, leading to systemic inflammation, leading to insulin resistance, leading to obesity, and then leading directly to cancer such as pancreatic cancer, breast, and many other types. So you bet it does. Now, on the flip side, on the high muscle content, I'm not as familiar with the research there, so I can't really speak to that. But definitely on the low muscle side, you better believe it. In fact, when people have cancer, when they lose muscle, they don't do well. They don't. And so we actively work to preserve muscle through cancer treatment. And when you look at conventional cancer treatment, chemo, surgery, radiation, people become very, guess what? Inactive. They lose muscle. And studies tell us that these patients deteriorate and they don't do well. And so we need to actually build in exercise that builds muscle.
It almost seems
you can't with those treatments.
Sure.
You just can't.
It almost seems counterintuitive, you know. When people have cancer, you know, I guess the thing in their mind is, I got to get rest, I got to, get stronger to overcome the disease. But getting in the gym actually is one of those things that helps. Something that you said about the inflammation, you know, I believe that people that have higher amounts of fat have more inflammation. Let's talk a little bit more specifically about the role that inflammation plays in getting cancer.
Yeah, I mean, it's absolutely scientifically evidence-based. That's a true statement. Fat cells produce inflammation. They're actually called crown cells. They actually change structure, and they produce inflammatory signals. Now, when people think about inflammation, it's kind of like stress. It's kind of like an abstract thought. It's like, well, I'm inflamed. Well, what does that mean? Guess what? We can test that and measure it. It's in many ways, it's looking at your immune system, and it's the language by which your immune system communicates. And so we can look and see what your immune system is basically saying to each other, and the environment thus that is the result of that. So absolutely. So let's look at men, because we're both men. So when you look at low testosterone as an issue, I've written 2 books on that. Actually, it was my first book, and I'm not even I'm not a urologist. I just happened to be taking care of women as a gynecologist. And they said, wow, you've helped me. Can you help my husband? And I was like, how hard can men be, right? Turns out men are probably more of the hormonal than women, but for different reasons. But, it's really interesting because there's a direct tie to low testosterone from obesity. The fatter men get, the more inflammation they get produced from those fat cells. But understand, a lot of that originates from the gut, which of course originates back to diet, even to vaginal birth and whether they're breastfed. But then those fat cells also, the inflammation causes the production of enzymes, such as aromatase. So aromatase is an enzyme accelerated in its transcription by inflammation from the same fat cells that then promote testosterone to estrogen conversion. And so this environment that basically sounds like it's happening sequentially, but it's all happening at the same time, starts to feed back to the hypothalamus and the pituitary and downregulate male androgen production. And so this is why we're seeing over the last 40, 50 years, a decline in sperm count, sperm motility, increasing infertility in men, and declining testosterone in men. And yet everybody is surprised, but then every man walking around, not every man, but most men walking around today have breasts.
It's just incredible.
Exactly. It's because of that environment that is really all working together, but it's contributing to the disease.
People are over fat and under muscled. Now, speaking a little bit more to immune therapy, I've heard you talk about immune therapy in a podcast and how the approach to the treatment of cancer should be to train the immune system against the tumor. Can you enlighten us a little bit on that?
Yeah, so probably the way I can answer this on a simple term is that aging increases the incidence of cancer. Most people would look at cancer and go, yes, it's a disease that we tend to see in the older individuals. Now that paradigm's changing, but aging equals cancer. But cancer increases aging of cells around it, which increases cancer. We treat cancer with chemotherapy and radiation, which guess what? Age further the cells, particularly the immune system. The body's defenses, whether against foreign enemies or domestic, it is the immune system. So what happens is as these cells age, here I'm particularly talking about the immune system, they don't work well. They're not identifying abnormal cells well. And they actually go into a state of called senescence, which is present in both aging and in cancer. And senescence is when cells stop growing, but they still remain metabolic activity. And they start to communicate with the immune system. They start to disrupt protein homeostasis. They start to disrupt growth factors. And all of a sudden, what happens is the immune system starts to dysregulate. It starts to not clear these senescent cells. And these senescent cells continue to exponentially increase, and the immune system becomes more dysfunctional, and the cancer cells become more dominant, more manipulative of the environment and of the immune system. And now the immune system can't even see it. So then the cancer just keeps evolving, rotating, mutating, like a car that blew a wheel, and its axle is on the concrete, spitting off sparks as it rages down the road. The immune system just can no longer see it. So what we must simply do is tap into the immune system's ability to identify the tumor. In many ways, it's through the aspects of senescent cells, which ties it back to aging, which connects aging and cancer together.
It's just amazing to me as a layperson how all of it ties together and how important it is for us to keep inflammation to a minimum and to work with our immune system to keep it strong. Now, let me come back to something you said earlier. We talked about testosterone levels in men, and especially in men that are over fat and obese, the testosterone level being low. Let's talk about the mirror image, the opposite. So if a man is undergoing testosterone replacement therapy to get his testosterone back to within a normal range, let's say, does that increase the risk of cancer also, or no?
Yeah, I think we have to look at the environment that it's being introduced to. Okay, so when I talk to people about hormones, I tell them, look, we can identify a man with low testosterone and then not recognize the environment that has precipitated that low testosterone. And then say, oh, we're going to give you testosterone and you're going to absolutely love it. And they will, and they may. But at the same time, we have no idea what the body's going to do with that. It's like telling, parents that have a 5-year-old, we're going to give you a box of matches, leave it on the counter, you go have a date, and we're going to leave that alone with your 5-year-old son. there's great stress and angst that would be permeating through those parents through dinner. But if you left it with a 35-year-old, you should rest assured they're not going to burn the house down. So you have to understand that low testosterone in most men and hormone dysfunction in most women, they are a effect of the cause. And the cause is underlying metabolic issues, but the immune system's tied into that. So if you then throw testosterone in the middle of a metabolic mayhem and immune dysfunction, the body is going to do sometimes things right with it, but it's going to do many things wrong with it. So in the context of where it is on that spectrum of how metabolically and immunologically things are dysfunctional, testosterone absolutely can propagate the progression of cancer. I've seen it in prostate cancer. I've seen it in estrogen-responsive breast cancer, endometrial cancer. It just depends on where they are on that spectrum of wellness versus disease.
Okay. And so it's important to approach low testosterone from the metabolic standpoint, and fix the metabolism first, before just throwing a Band-Aid on the testosterone issue by undergoing testosterone replacement therapy. Now, I have heard you in another podcast. I've listened to a lot of your material, which is wonderful, by the way. And I encourage you guys out there that are watching this podcast to go and check it out, because it's just amazing. You've talked about using protein peptides, precision peptides in cancer treatment. Can you talk a little bit about that?
Yeah. So, of course, proteins are amino acid chains that are above 100. And less than 50 is called a peptide. And people go, well, what is a peptide? I'm not really sure I believe in that. I know a lot of the integrative space is using that. And it's like, well, insulin's a peptide. And people go, you're kidding. No, it's a peptide. So it's something that's very real, that's very available in the commercial, conventional cancer care. But here, these are just really short amino acid chains that are affecting metabolic function. And so precision peptides, precision is really the future of cancer care and the future of medicine that's available today. It's simply the right treatment for the right patient at the right time. But it's not as what we've done with conventional cancer care, because that's what I do on a day-to-day basis. But it seems that we're getting into the regeneration and anti-aging, that we come in with a big drug that has a very specific target of action to block something, to destroy something, completely obstructing, versus with peptides, you're influencing function. And so that's really what these precision peptides are. They're matching in a metabolic dysfunction, and you're using short protein chains to influence function rather than to just shut things down. And that's what peptides are. And the precision nature of them is just the targeting of them to influence the function, but to not just obstruct and shut something down.
Are these precision peptides tailored, personalized for the individual?
They can be. Now, peptides are definitely available in over-the-counter, right? So there are many peptides that you can use both for optimal performance, health, wellness, cancer treatments. But these are working in more of a very, very customized, individualized approach. We actually go through testing to actually determine expression related to cancer, related to cancer, and then targeting it with these peptides, which are actually given via intramuscular injection and IV. Now, these work really well in conjunction with other therapies, but it's just taking this concept of peptides and just precisely targeting.
Okay. So shifting gears, you have a lot of experience with high dose IV vitamin C therapy, quite a bit. Let's talk about that for a second. And what is its role in cancer treatment and or the immune system?
Wow. That's a big question. So I guess we'll be here for about 3 hours. Vitamin C.
Give us the laypersons.
Yeah, vitamin C is really interesting because it's not new. A lot of people think about Linus Pauling back in the 60s when he was involved with 2 studies where they gave 10 grams IV vitamin C. I think it was 1967, 1968 to be exact. And in terminal cancer patients, they were able to statistically improve survival time. Then a group of docs that were connected to Mayo decided to repeat that. And instead of IV, they used oral, by mouth, vitamin C. And in today's day and time, people go, wait a second, oral and IV, that seems like a little bit of a difference there. Well, at the time, nobody saw the difference. Guess what? Big difference. So vitamin C high dose in an IV route, it is probably the flagship of integrative medicine and integrative oncology as a whole. It's got a plethora of evidence supporting its use. The problem is most people are underdosing vitamin C, or they're even dosing it with oral. So when you treat cancer with high-dose IV vitamin C, we can target it just as much as we can with the peptides. If we give oral vitamin C, research is very clear, we will never achieve a therapeutic plasma ascorbic acid level, which is what vitamin C is, which at the bare minimum is 1,000 milligrams. We will never achieve that by the oral route. And it's because of what's called two-phase pharmacokinetics, which basically when you first start taking vitamin C orally, the GI will absorb it. The gut epithelial cells will absorb it. But the more you give it, the gut epithelium starts to downregulate the absorption. And so you'll never be able to achieve a therapeutic level. The only way you can do that is with IV. Dr. Reardon back in the 90s, actually through preclinical studies, was able to determine that the optimal plasma ascorbic acid level to directly be cytotoxic to cancer cells is about 350 to 450 nanograms per deciliter. Now, here's the problem. You have to give a lot of vitamin C. Typically, we're talking about 1.5 grams per kilogram.
Wow.
And then you have to give it over a duration. Okay, so it's not just dose, it's about duration. But there's massive number of variables that play a role in this. The body size. If you have a 6'6", 366-pound individual sitting next to a 5'2", 125-pound patient, the patients are going to go, why is that guy getting the same dose I'm getting? Because he's 3 times me. Mm-hmm. And that's true. The body weight, tumor burden, level of inflammation, level of vitamin C deficiency, the metabolism of vitamin C, so many things that go into proper dosing. This is why you have to give vitamin C, then check plasma ascorbic acid levels, then readjust the dose. Because where else would we not do that in medicine? I have high blood pressure. I'm going to give you an antihypertensive. Great, doc, what do I now do? Go home, live your life. Shouldn't I come back to check my blood pressure? Oh, good idea. That's exactly what needs to be done. Because when we then dose that, we've got to adjust that dose to not only saturate the plasma, but get it into the extracellular space, deliver it to the tumor, and saturate the tumor microenvironment, saturate the hypoxic and the normoxic areas of the tumor, and then let it not just directly kill the cells via cytotoxicity, but actually target detoxification, lead to a detoxification crisis, lead to an energy crisis. So it really works at a multitude of ways.
That is just so interesting. What a dynamic there. I'm going to shift gears.
It's great. It's amazing. It's amazing.
Yes, it is. Yes, it is. I'm going to shift gears to something that I heard you say. When other doctors have asked you in the past, why give hope to a patient with cancer? And I got to tell you, your answer really touched me. You told them, because I'm a doctor. You said if you can find the possible, you restrict your outcome. I love that.
Oh, wow. This really gets to the heart of who I am. When you talk about my podcast, that was my old podcast. We are relaunching a new podcast, which is called Prescribed by Dr. Nathan Goodyear. So you'll be able to see that.
And is that going to be on YouTube?
Yeah, it will be. Will be on YouTube.
Okay.
We have one podcast already up. It's for repurposed medications. It's called Off Script RX. You can find that at off-scriptrx.com. I don't know how long that one will stay on YouTube, because we talk about some very contentious things as it relates to the research and repurposed medications. But it will be on Podbean, so you can find the video there. Oh, medicine is an identity crisis, and doctors are front and center. The word physician means healer. The word doctor in Latin could be translated to mean teacher. And so what that really points to what physicians are and doctors are is we're healers, we're teachers that heal. But what's happened over the last 50, particularly in the shorter term, but longer term, about 100 years, is we physicians have forgotten that we serve patients. We have got what I call advocacy confusion. We are supposed to be only advocates for patients, but we've become advocates for government regulatory bodies, government, insurance, hospitals, everything but patients. And so when it comes down to hope, the basic foundation of what a doctor and patient relationship is the doctor is to give the patient hope in remediating whatever disease they have, because that's what medicine is. It's the treatment of a disease. And you even see this where medicine is getting into euthanasia now. I was just talking with my brand director about an instance in Canada where there's this machine that somebody gets in and it just slowly takes away the oxygen and it kills the patient. Hope literally means confidence in tomorrow. That's it. That's it. So when a patient comes to me with cancer, they say, "Doc, I have stage 4 cancer." Yes. I tell them, look, there's hope about tomorrow, because whether I'm there or you're there, tomorrow is going to be there. So my job as your healer, as your teacher, and a lot of people go, "Oh my gosh, healer, how can he say that?" It's to build out what that hope looks like. But if I go in and say, "Yes, you have stage 4 cancer, there's no hope for you, you will die in 3 months," I have ripped out any possibility about what that future looks like. That is unethical. That is not foundational to what medicine is. And I don't know where the heck it's come from, but you see it permeating in what medicine is moving towards. I mean, we're literally going to have 2 styles of medicine. Medicine that works to heal patients and medicine that just, I don't know, does something else. It's scary. It's scary. But they're lumped together. And so what happens is patients aren't aware of this paradox within medicine. They're completely unaware. Not just if you have cancer, but also in the prevention. Because of this overlap, this crossover between cellular aging and cancer, but really the immune system. Because we're going to be able to be better at preventing cancer, but in a very customized way, in a very individualized way. And so that's exciting to never get cancer. I don't know anybody that comes into my office and says, "I'm super excited, I got this type of cancer. They say it's the best type of cancer." It's like, there's not a good type of cancer. But when it comes to cancer treatment, which is, in most people's mind, it's a horror story that they live through when they hear those words for the first time, which is surgery, chemo, radiation, which literally is going to war on the body, trying to eliminate these basically cells that have taken on a different identity. That's really what's happened in cancer. And in fact, when you look at cancer, it's the only disease that's been declared on. And it's had war declared on it by the United States. Nixon, 1971, declared war on it. We're going to move away from surgery. We're going to move away from chemotherapy. We're going to move away from radiation. And we're going to go right to the tumor. That's actually what we're doing at the Williams Cancer Institute, Lee. We go right to the tumor. Intratumoral ablation with what's called pulse electric field therapy, which is simply just nano pulses of energy. It destroys the internal components of the cancer cell, leading to new antigens, activating the immune system against it. And then we inject intratumoral immunotherapies to activate the immune system. Pulse electric field therapy is simply going into the tumor with a probe. We do it under CT guidance or ultrasound guidance, but mostly CT guidance. We do that at a hospital in Cabo, very pristine hospital. in a hospital in Mexico City. And it uses nanopulses of high velocity energy. And by doing that, what happens is it bypasses the membrane, the cell membrane of the cancer cell. It bypasses its polarization, gets inside the cell and kills mitochondria and other organelles. Now, what that does is that triggers the cancer cell death, but we target it so we don't damage healthy cells.
That's
but
really
that
interesting.
Non-thermally, so it's not heat-based, that releases new antigens, dead pieces of the cell, and thus the immune system can react to it.
Mm-hmm.
And then we inject into the same site in the same needle, so we don't move the needle, intratumoral immune activating agents to then basically mix the cocktail and just let the immune system start to do its job.
Wow, that's really interesting. I was going to ask you something on that immune system. These biologics, like Humira and so forth, are becoming very popular, and they work by suppressing tumor necrosis factor, as you're aware of. And so, just from a layman's perspective, the question that I have in my mind is, by suppressing the immune system, you're bringing down inflammation, and by reducing inflammation, you would think that actually helps to prevent cancer. But the flip side is that if you're reducing the immune system, are you letting cancer cells proliferate? Which one is it?
Well, it's complex, and I think if you simply accept that it's complex and then say, okay, let's work it, it makes it much more accessible. In our minds, we look at immune cells and go high and low. And really, that's not what the immune system is about, because we can have a massive number of T lymphocytes, but they don't do anything. They're naive. They don't recognize, or they don't do anything. But man, we got a number of them. And you have cancer. We could have a smaller number of lymphocytes, but man, are they active. CD4 cells, CD8 cells, working triad with dendritic cells. These are just different immune cells. And boom, the immune system identifies the cancer and eradicates. So, and when you look at those three types of immune cells, T lymphocytes, CD4, CD8, and then dendritic cell, what's called an antigen presenting cell, inflammation is not in and of itself bad. You get a paper cut, you recognize that. It hurts, it's swollen, it's red. But then when the body starts to heal, the inflammation, the immune system calms down. Inflammation is a byproduct of an active immune system. What we have to have is having the immune system do its job and then quiet down, like that paper cut. And that's what happens in cancer but it's not the origin. A lot of this is coming from the gut and epigenetics, is the immune system is not calming down. It's not quieting down. It's perpetuating, but it's through those senescent cells, through the gut microbiome, through poor diet, all of those things. And it doesn't calm down. And so it perpetuates this state of immune dysfunction. We call it inflammation. That's just a byproduct of miscommunication. I guess it would look at, a couple that's having, a dispute at home, and they blow the house up because of their dispute. The cops show up and they go, well, what happened? The house blew up. Why did it blow up? The couple wasn't communicating well. Okay. So what we see in inflammation, in not inherently bad, is that miscommunication within the immune system. So I believe that simply looking at these immune cells is not enough. And we do this. We must look at the communication language between the immune cells to assess fully the environment. And that really helps us to identify, for example, look at TGF beta, transforming growth factor beta. Low levels is bad, high levels is bad in cancer. So it's the sweet spot. It's finding the sweet spot there. And I think that's where we are. Everything's on a little bit of a sliding curve there, and it's trying to find that right position where the immune system is balanced, it's clearing senescent cells, clearing abnormal cells, but it's still strong enough to fight off infection And that is going to be something that's unique, that we're only beginning to understand the complexity of this process.
Wow, it's a real balancing act.
The great thing about this, we have to do it right now in Cabo and Mexico City, but we're working with like the Mexican FDA and other areas to try to bring this to more people in the United States. We can target these tumors and protect the immune system, preserve the immune system, strengthen the immune system, and then start to help cells get younger. Because aging accelerates cancer, cancer accelerates aging, and chemotherapy and radiation accelerate aging. What if we made them younger? That's what Dr. Williams said. I'm like, can we do that? Guess what? We've been doing it for a year and a half.
Wow.
And you're going to start to hear more about it. So the treatment goes right to the tumor, activates and preserves the immune system. And here's the kicker. Patients actually get stronger. They get a higher quality of life as they go through treatment, rather than just trying to get through treatment, survive, and then heal. No. That can happen at the same time. And it's actually going to happen today, just not in the U.S. yet.
Well, you guys are certainly on the forefront of this cutting edge technology. And I think it's a great service that you guys are doing, to try to expand the possibilities for people who are fighting cancer. Dr. Goodyear, this has just been great. Is there anything else that you would like to leave our viewers with?
Yeah, currently you can find me on off-scriptrx.com. It's script like SCRIPT-RX.com. The website there, the podcast is there, and it'll be on Podbeam. We talk about all things repurposed medication, but understand repurposed supplements and vitamins and nutrients as well. And we get into the anti-aging there. Ivermectin. Ivermectin has a lot of potential as a age regeneration, anti-aging mechanisms. We talk through the deep dives on the science, but then my personal, which is kind of going into just maybe some things that are off from just medicine and deep dives in science, will be pre-scribed, pre-scribed.com. That website will be up probably in days, and that podcast it will drop there shortly thereafter. And then you can find me on all social medias. We do all kinds of reels and stuff like that.
That's wonderful. We'll be looking for that. And you do have a great Instagram account, where you regularly upload short and very useful videos. So, hey guys, I would ask you to look on Instagram for Dr. Goodyear. Thank you so much for sharing your wisdom with us today.
Well, Lee, I have to, hats off to you and what you're doing, because you are helping to force multiply and empower individuals.
Thank you.
That's what we need more of, because that's what will be the force change to the vector of medicine. It won't be doctors. It'll be patients, individuals. They will say, no, doctor, I'm not doing that. And then doctors will follow suit. But it's through your work and others like you that are helping that to be possible. So thank you to you. But the future of cancer care is super exciting.
And thank you once again, Dr. Goodyear. Hey guys, help us to grow the Lee Labrada Show by sharing this podcast with just one other person. Would you do it now? And be sure to hit the subscribe button and leave your comments and feedback below. All right, you guys, stay motivated, get up, look up. God bless you.
The Lee Labrada Show.
Voices in my head imprison me. Wanna hold me down, but I want more. You're the light that's cutting through my pain. You're moving me, oh Lord. I just